Hi, everybody. Dr. William Davis here. I want to talk about something I call the Wheat Belly no change rule. That is, no change in blood sugar, comparing a pre-meal to a post-meal blood sugar. Okay. Well, why do this? Well, there's two really big benefits of following this Wheat Belly no change rule. One, it maximizes your chances of becoming a non-type 2 diabetic. Isn't that great? You can get off insulin, you can get off oral drugs and injectable drugs by doing this. The majority can. There's an occasional person who can't become fully non-diabetic because some people, maybe about 5 to 7% of people, who have done damage to their pancreases. And the pancreas is very bad at recovering. And so those people sometimes have to remain on some medication, but at least you've minimized, one, your medications, and two, the complications of having repeatedly high blood sugars. Okay, that's what leads to blindness and kidney failure and all that sort of thing. So the no change rule is very helpful in helping you become a non-type 2 diabetic. The no change rule is also very helpful for accelerating weight loss. Okay, because if there's no change in blood sugar, no rise, you don't provoke insulin release. Recall that insulin is the hormone of weight gain. So every time insulin goes up, you store fat, where you're not going to raise insulin. So it allows your body to mobilize its fat and lose weight more quickly. Now, in order to do this, you're going to need a glucose meter. There's a whole bunch out there. You can go to Walmart, for instance, their own brand. It's like less than $20, I believe. And the test strips you'll have to buy also. Those are also inexpensive. And you'll have to buy also the finger stick devices, also inexpensive. So you'll need those three things. Here's one of my favorites. It's the Dario device. What I like about it is it communicates with your smartphone. And so it'll talk to your smartphone. You can track your blood sugars on your phone. So that's Dario, D-A-R-I-O. It's a little more expensive, a few dollars more expensive. So what you're going to do is do a blood sugar just prior to a meal and then 30 to 60 minutes after the start of a meal, okay? What we're trying to do is capture the peak blood sugar. Doctors often tell you check blood sugar before a meal and then 2 hours later. They're looking for whether your blood sugar is coming back to baseline on your drugs. Okay, that's not our concern, right? We want you off the drugs. So we do it. We check a blood sugar 30 to 60 minutes after the start of the meal, and we aim for no change. Okay. So what if you start at a blood sugar of 100, and you eat your dinner, your meal, and the blood sugar is 148? Look back at your meal. Identify which food did that. It'll be a carbohydrate food. Okay. Next time, cut back, or even better, eliminate that food and eat more of the other food, maybe an extra pork chop or something like that. What if your blood sugar starts at 100 and the next one is 105 or 95, give or take 10 or 15, that's the error of these devices, you're fine, no change, right? What if you start, say, 85, perfect blood sugar, and it goes to 95? As long as you're below 100, you're still pretty good, okay? That's essentially no change anyway, given the error built into these devices. So stick to that over and over and over, and what happens? Well, the fasting blood sugar comes down, and you do not need the medications anymore. Now, ideally, you work with a healthcare practitioner who understands these principles. Unfortunately, 98% of them don't, but try to find somebody to help you at least reduce your insulin, reduce your glipizide, glimepiride, glyburide, those kinds of drugs, reduce your injectable drugs. Insist that your doctor help you get off these drugs. Hopefully they know what they're doing. Because one thing we do not want is hypoglycemia. You can see a lot of discussions about that in the Wheat Belly blog and the Undoctored blog. Okay, we do not want any hypoglycemia. And as you become less and less diabetic, and you don't reduce the medicines sufficiently, you can have hypoglycemia, which is an acutely dangerous situation. You do not want low blood sugars. Okay, so I'd rather, if you were my patient, I'd rather have high-ish blood sugars, no higher than 200 preferably, in the midst of trying to get you off the medications. Okay, because I'd rather have high-ish rather than low, because low can be acutely life-threatening. A couple of tips: when you do your finger sticks, you want to use firm pressure. So when you click the device and it does a finger stick, you get a nice little dot of blood. Do not squeeze your finger. Okay, people milk their finger like they do that. Don't do that, okay, because that screws up the value. If you're not getting a big enough drop, even with firm pressure, and you set the depth setting on the finger stick device to the lowest it can, that is the deepest, what I do is just bend over and let your arm hang down. Let gravity cause blood to come to the finger you've stuck. Okay, so follow no change, the Wheat Belly no change rule in blood sugar, and you'll see magnificent results in both getting off diabetes medications and becoming a non-diabetic, and also accelerating weight loss. You know, if you become a non-diabetic, you are spared from kidney failure, much reduced risk for heart disease, stroke, cancer, dementia, and you add many years to your life, okay? So it's so important that you follow these kinds of ideas and get rid of the diabetes.